Welcome to Norfolk Perspective City Slice. I'm Bob Batcher, and I'm going to start this off by saying, Sarah, I'm confused. Sarah Fuller, who is the director of Norfolk Community Services Board. How are you doing?
I'm doing great.
It's interesting times, isn't it?
It is.
And if I were to say that it was a roadmap to a certain destination, you would say it's a spaghetti strap instead?
It's every day is an exciting adventure. How's that?
Okay. Now, and it never fails. Whenever I come to talk with you, it's because I am coming from a point of total confusion, and it is like spaghetti coming together because you've got multiple layers of service providers. You've got some issues that some of us are saying easy to solve, but you've got a customer base or a client base that says, I'm confused. So what is it we want to talk about for the next 10, 15 minutes?
So one of the things we want to talk about today, primary reason we went to come today, is to make sure that the community understood about a new Medicaid benefit that's a demonstration program that the state of Virginia has partnered with community services boards and federally qualified healthcare centers to help persons that have a serious mental illness who do not currently have insurance qualify for Medicaid, apply for and see if they qualify for Medicaid, a new Medicaid benefit.
Okay, and I'm going to be frank, that sounds really easy, but look what they told me to talk to you about.
Federally funded, state-supported programs run through community services boards are never one-pagers.
Right. So so Sherry, help. Okay, let's set some terms here. Because you're going to be hitting me with some actually acronyms, right?
A couple.
Couple.
That's right,
so,
a couple.
Okay, Medicare.
Medicare is the federal government's insurance plan, and it's primarily for elderly and people who have disabilities.
Okay.
And that's through the federal government, and it's the same pretty much state to state.
So when my wife and I are dealing with her father, 95-year-old father in upstate New York, and her sister's talking about Medicaid and all that, Medicare and all that, it's pretty much the same thing.
That's right.
Okay.
That's right.
Where I start getting confused is we start trying to tell that same sister-in-law, well, you ought to do this because Medicaid in Virginia says this. Is that where I get off track?
That's right. That's right. Medicaid is different in every state. Medicaid is a partnership between the state government and the federal government, and it's kind of a contract between the two entities. And the two entities have to come to an agreement about what kind of services and who is going to be covered under those benefit plans.
So obviously today we're going to be talking about the person who lives in Norfolk or in the state of Commonwealth of Virginia, not my father-in-law in New York at this point because it's different.
That's right.
Okay.
That's right.
So how does Sarah and the Community Services Board kind of get into this?
Medicaid has providers in the community, and the Norfolk Community Services Board is one of our most loyal and long-standing provider. The community services boards provide mental health and substance abuse services, which are covered through this project. It's called the GAP. It's the Governor's Access Plan for the Seriously Mentally Ill, and we're calling it the GAP. And it's a combination. Part of what the demonstration does is it covers mental health and substance abuse services and physical medical conditions too.
Okay.
So it's a coordinated care demonstration project. What we're trying to say is to all of our legislators and our stakeholders that if we meld the coordination of these two kinds of services together, mental health and medical, that people have better outcomes, and in the long run it's much less expensive.
Okay.
Part of what we do is by having it through the Community Services Board, they're a known entity in the locality,
Right.
and so people can go to the service board and get help applying and get good, solid information about really what is the application process and what are the services that are covered.
Because Sarah, when I look at mental health and then medical diagnosis, if you go in with the flu, they diagnose it, they might give you a prescription or they tell you to go to bed for 10 days and you'll be over it. Mental health doesn't work that way, does it?
No, mental health doesn't work.
And is that kind of where we're at, though?
Well, I think a lot of it is there's these people that are falling in the gap.
Yeah.
I think it's a well-named program. Is that they haven't either been in the system long enough or gone through a rigorous enough application process or haven't been declared severely disabled enough to qualify for disability. benefits. And so they don't get the insurance, the Medicaid, and then eventually the Medicare that comes with that disability benefit. They have a significant enough mental health experience that it is impacting the way that they function. There's too much to maintain full-time employment and a lot of other things we consider as the daily functioning stuff. So there's some barriers to that. And so there are adults that certainly have major mental health problems. It is not something that's easily it's cured. It is all mental health symptoms can be treated. It is a very livable condition. It's a very recoverable condition, but it's usually something that people have to work on for the majority of their lives to help themselves
work on, stay on,
be well. Yeah, it doesn't necessarily mean everybody's on medications, but it does mean you've created some type of recovery plan for yourself. These folks that don't have this disability benefit and aren't full-time employed and getting insurance from the employer, they don't have any way to pay for treatment. Many of them come to the Community Services Board. We actually receive funding from multiple sources. We make sure they get the mental health services that they need, even if they don't have insurance. What we can't do, though, is help them access medical care. And so what this does, it provides them I think we'll call it a limited Medicaid benefit.
That's right.
Doesn't cover everything regular Medicaid covers, but what it does do is give them the ability to be able to choose their own psychiatrist, go to any pharmacy they want and fill a prescription, not have to go to churches and family members to get up enough money to pay for a copay to go see a doctor or to get a prescription filled, pay the full fee of prescription, and then they have the opportunity to say, okay, I'm going to treat my depression and I'm going to treat my diabetes. Because I can treat my depression, the Community Services Board can help me treat my depression, but if I continue to struggle to maintain appropriate treatment for my diabetes, I'm going to die sooner, or I'm going to become more disabled. I may end up in a nursing home for something that was completely avoidable if somebody had health coverage. This is really important. This will save people's lives for people who are not in a position and haven't been found eligible to have a long-term benefit program.
Sherry, for a lot of us who are watching this show, I mean, I'm sitting here thinking, okay, all I got to do is pull out my billfold, and I've got that infamous health card, and I can pick up my primary care, physician and make an appointment.
That's right.
And I might gripe about my copay, but we're not talking about people who even have the billfold, let alone the card. So how do we get access to them then? How do they get access into the system then?
There's two ways that people can apply for the GAP. One is through the Community Services Board. They have to go through a mental health screening, and that's done right at the Community Services Board. And then they can contact Cover Virginia, and that also can be done through the Community Services Board. The staff there will help them with that application process, and that's kind of a financial application. They can call Cover Virginia to get information ahead of time if they like, or they can call the Community Services Board as well.
Because they've already made that phone call and know what it's all about.
That's right. That's right.
Now, we're really we're in a real time of adjustment in our whole delivery services. I mean, not here to pass any judgment on it. It is what it is. But I mean, we used to have way back when people our age can remember when, okay, you're sent off to Stanton, or there's another place to go. There's a home for you, and then there was nothing. So we're kind of going through some transition times now, aren't we?
That's exactly right. The goal of the GAP is to make sure that we have coordinated, integrated care, both medical and behavioral health services, and it's to avoid people having to go into a more intense setting, like in inpatient setting. It's to help them avoid having to make expensive trips to the emergency rooms. So we're hoping that if we can give people just some services on an outpatient basis, that they can stabilize their symptoms, maybe start employment, maybe have more steady employment, possibly be able to reestablish some community connections and start having a life of their own.
Because you said something that was really significant. yeah, maybe I can get a handle on my diabetes. It's a slippery slope if you don't get started.
And we do want people to get started. That's why we've set up a team of specialists to be able to help people come into services, whether they understand the program or not. They have a serious mental illness. They do not have any current health care coverage. We want to talk to them. They can call 823-1600, or they can come to the Community Services Board location at 225 West Olney Road. We're going to help them get started, and we have care coordinators that actually can help them then manage their care and coordinate their appointments through this once they get approved. So we're really excited to be a partner in this.
Yeah, it's really cool. What would you say to the person, because I know, who knows someone who might be close to getting a crisis? Because there's the simple solution. Well, go call a doctor, go to the hospital. But how would you advise somebody to kind of put their arm around somebody's shoulder and say, hey, let's take you for some help?
Well, there are lots of ways people can access help. If someone's in an active crisis, we want them to start with our emergency services line, which is 664-7690, or they can call dispatch and request that we call them or come out to help them with a mental health emergency. If somebody's actually just trying to figure out how to get their hands around navigating their care on a mental health basis, and it's something that their primary care physician hasn't been able to help them with, and they can come to our regular intake office, and we can see if there's something that we can do to help. Cool.
So instead of reading all this or having you on your sofa at home, I can call you at what number?
823-1600. And if you're calling for GAP, we say just ask for GAP, and you'll get directed to somebody that can help you.
You know what? I'm not as confused as I was 10 minutes ago.
We're glad.
Because I know that I got two people who are working together to make it easier. It's just a matter of going out there and getting access to it now. Thanks a lot.
Thank you.
Thank you.
Thanks for joining us. And put that arm around somebody's shoulder. See you later.